We deal with the recent surge in COVID cases. There are many questions still surrounding the virus. And here to help answer some of those is Dr. Lucia, the Chief Medical Officer of McLane Children's Hospital. He joins me now live. Dr. Lucia, of course, thanks for joining us. We do appreciate you checking in.
Thanks for having me.
All right, now that the pleasantries are over, let's get down to it. Earlier, we showed video of people lining up for hours just to get the vaccine or to get tested for COVID. You think that's a wise thing to do?
Well, I think the answer is a little bit different for everybody, quite frankly. I think that those that are high risk or those that live with someone that is high risk should really be at the front of those testing lines right now. I also realize that some folks need to get back to school and back to work, and they need that negative COVID test to do that. And it's really difficult right now because the demand is way outweighing the supply. I think there are some that if you just have mild symptoms and you're able to self-isolate and you're otherwise healthy, waiting to get that test until that supply catches up with demand is a very reasonable option.
You make a great point, though. If you need that test for your job or for travel, you've got to get it quickly, so I can understand the long lines. Now, should we just stay at home if we have the COVID symptoms and then treat it like we would normally if we had the flu, or should we try to go out and get tested so that we are aware and we know who we're coming into contact with, of course?
Yeah, it's a great question, and it's going to be dependent on the health status of the person. If you're having any significant symptoms, severe shortness of breath, and you're in one of those high-risk group that we're so familiar with, those with lung problems, obesity, other health problems that complicates COVID, and you're having symptoms, you need to get tested, and more so yet, you need to seek medical care. That being said, if you're in that group that's healthy and can isolate from those that are high risk, it's reasonable to wait right now as long as you're able to do that.
And doctor, we're seeing some COVID fatigue out there. A lot of people have been telling us that, maybe 2 shots, I'm done. I got my 2 shots, maybe even got the booster, and I'm done. Why do we have to keep getting boosters? Why can't it just be like the flu shot where we get a shot and we're good for the year?
Yeah, that's a great question, Chris. And it comes down to the fact that COVID is not yet endemic like the flu is. So with the flu, we know generally the months that it's going to occur. We know from other parts of the world the variants that are going to occur, so we can target that vaccine to the flu. COVID, as we've seen over the last 2 years, really doesn't have a time or season yet. We've seen it in the summer, we've seen it in the winter, and we're in the middle of yet another wave right now. Once COVID becomes more endemic, meaning there's not these large waves of morbidity and mortality, then we would hope there's a little more seasonality to it, and then we can do just an annual shot. But until then, we have to stay vigilant, and if you can get the booster and are eligible for it, it's the best thing to do for your health and your families.
All right, doctor, that's the best, most clarifying answer I've heard on that so far, so thank you. Okay, one more. This is really the brass tacks. Hospitalizations and deaths. Are you seeing more Omicron deaths as compared to other variants?
So that's a great question. That's a little bit early right now. So when you talk about deaths, that's usually the last thing to increase. We see the positivity in the community go up, which we've definitely seen here in Bell County. Then we see the hospitalizations go up, which we've seen consistently, certainly in the adult population. And then finally, the lagging metric is deaths. And we do expect to see that rise as we hopefully near the end of the Omicron wave.
Okay, terrific. Another great answer. Okay, real quick, I got 10 seconds to answer for you. It said that kids are being affected much more. Are you seeing more children getting infected now?
We're seeing more kids get infected. It's an incredibly transmissible variant. That being said, it's not been as hard on kids, less hospitalizations so far with the Delta variant, and we're keeping our fingers crossed because we're dealing with flu and other things that happen in the winter as well.
All right, Dr. Lucia, very clear, very precise answers today. You're a fountain of information. Really good stuff. Thank you very much for checking in with us today. I know it really helps our audience, and I learned a bunch myself. Thank you, doctor.
Thanks again for having me.
You bet. All right. Again, everybody, if you need to get tested, there will be plenty of locations to get COVID tests or vaccines over the next week. As we mentioned, a vaccination and testing clinics just opened in Temple today, and it runs until 6 o'clock. There are also clinics in McLean County. For a full list, we're trying to make this as easy as we can, of every testing and vaccine site. Just text the word TEST, T-E-S-T, to 254-777-6000. We're going to send you a detailed list. That link just comes right to your phone. Now,